Hello, my name is Tina Duong. I'm a physical therapist at Sandford University, and I'm going to talk to you today about exercise and muscle training techniques for SMA families and patients during the COVID-19 lockdown. So these are the things that you can do when you're at home and unable to see your therapist or your care providers. Disclaimers. This slide deck was developed in collaboration with myself, Tina Duong, a physiotherapist from Sandford University, and Roche. It is intended to help support families as well as yourself throughout the COVID pandemic to provide supplemental home exercise program ideas when you're not able to be in clinic. The intended deck is not meant to replace any kind of healthcare professional support or input. It is just to provide some practical guidelines and examples that you could use at home during these unprecedented times. Please consult with your healthcare practitioner prior to starting any of these suggested exercises. The content of this deck represents my opinion and not that necessarily of Roche. Roche takes no responsibility for any consequences of the exercise mentioned or discussed above, so please do consult with your healthcare professional prior to starting any exercise. Now, how to use this slide deck. This video slide deck contains information and videos to help SMA patients and families during this lockdown period who's having a difficulty time going to physical therapy appointments in a live setting. For best results, pause the video on information slides as you read through it, then you can unpause to continue the progress. The video demonstrations and home resources to do these exercises are suggestions, but will be dependent on your individual abilities. Please allow time for yourself to watch the demonstration videos prior to doing the exercises. Today's objectives include introduction to neuromuscular education, which is a framework that's used in physiotherapy for rehabilitation. We'll talk about some considerations for exercise and facilitation techniques used as part of modalities in physiotherapy. Exercise chapters will include elbow flexion. We'll look at it from a gravity eliminated as well as anti-gravity position. Chapter 3 is on head control. They will spend chapter 4 and 5 talking about trunk control and different handling techniques that your caregiver could use to help you obtain some of these positions, as well as active sitting. And then we'll end with chapter 6, which we will talk about some transitional aspects of mobility, including lying all the way to standing up. Neuromuscular education. What that is training your muscles, brain, and nerves to communicate and improve movement. It's a mind and body connection. This is needed to establish a visual connection to the movement. And you could do this by using a mirror so that you could see what's happening, as well as using your eyes to guide where you want to move to the targeted movement. And then we'll also talk about facilitation techniques to wake up the muscles. For those of you who have been less mobile, some of your muscles may have forgotten how they should be working, and so there are a few hands-on techniques to foster the communication between the mind and the muscle movements. A few facilitation techniques include awakening of your muscles. Some of the skills to do this includes tapping, and it is exactly what it sounds. You will apply a tapping motion over the tendon or the muscle belly of the muscle that you're trying to activate to get it to wake up. Another technique that wakes up the neurological system is called brushing. And you could do a fast brushing across the muscle along the direction in which the muscle should be activated in a concentric fashion to wake up those muscles. Lastly, to add input into the joints, you can do joint compression. So for joint awareness, you can wake up receptors in the joints, and this is typically used when we talk about stabilisation or co-contraction of muscles around a joint. A frequent question that's asked towards physiotherapists is, what type of exercise should we do? Exercises can help as long as it's done in a consistent, regular manner. And exercises that you choose should mimic the activity or the goal that you would like to accomplish. General training is going to help in a very general way. For example, improving strength and increasing stamina will help overall, but may not provide the best practice for learning a specific technique. Studies have shown that specific training will be gained in a specific way. For example, If you want to walk, you want to make sure that you break down that task and work on the muscle groups and the way the muscles should be activated in the walking fashion. When we talk about training, everyone has different degrees of muscle length tension relationships, and that affects the biomechanics of movement, particularly those individuals who have contractures. So muscle fibers do not produce the same force throughout the entire range of motion. And so that's why, depending on how strong you are, you may be able to lift your hand partway through the motion, but not the entire motion itself. The greater the range of motion, the more muscle is being awakened and trained. As such, you should make sure that you have enough space in your room, which allows you to move your arms and legs as much as possible without hitting other objects or restricting your ability to stretch a muscle at its full length. Get a sense of which areas of range of motion are weaker versus which areas of your range of motion is stronger, such as getting your hand to your mouth. If you're unable to start the motion, you may have a caregiver or somebody help initiate the start of that action. And then once you shorten that length tension curve, you may be able to get your hand to your mouth a little bit easier so that you strengthen throughout the range of motion and not only the aspects of your range that are stronger. Considerations for muscle strengthening exercises. Remember, the quality of movement is better than the quantity. So focus on the facilitation techniques we talked about. Visualize what muscles should be working and concentrate on that when you're doing your exercises. Use the muscle and not the momentum. Again, same type of technique. It may be more rewarding to be able to get your hand on the table or throw your hand to your mouth. But remember, control will get you where you need to go faster than using momentum. And with that, check your mechanics and plan on using devices or caregivers to assist through that range of motion to help you strengthen in the entire range of motion when you're exercising. And of course, consistency is key. When practicing specific movements, try and make them as consistent as possible to better understand and improve the training itself. And of course, appreciate all the successes. Every success is another step to your end goal. When you're at home, there is equipment that you can just use at home. It doesn't have to be fancy weights. You can use anything as long as you can hold it, start light, then gradually move up to larger, heavier items. This is a good time where you may want to consult with your physio to help progress your home exercise program along the lines of what's individualized for you. In a training program, we like to recommend what we call the FITT principles. FITT stands for frequency, intensity, time, and type. Frequency is how often you work. This should follow your schedule. You want to allow time before and after for preparation and rest. Intensity. This is how hard you work. Make sure that the pace that you're working with suits you and where you are. Start slow and increase gradually. I usually recommend for intensity that you should be able to talk. There's a way to measure that called the talk test. So whether you're doing cardio, strengthening, you want to make sure that you're still able to hold a conversation, and that will keep you at a level of moderate intensity that's recommended by the standard of care guidelines. And of course, time. Keep track of how long you're exercising and make sure it aligns with your capabilities and strength. You don't want to overwork your muscles so that you're so tired you're not able to perform your activities of daily living. And lastly, T for type. Try to provide a variety of exercises that encompasses the spectrum of flexibility, strengthening, and endurance, and change it up a little bit so you don't get bored, so you can stay encouraged to continue to exercise. A good way to do this is to track it with an exercise calendar, and you can touch base with your physio or develop your own exercise calendar so you can measure the FITT principles as outlined. Different elements of muscle strengthening and movement will help different types of daily activities. Your home exercise program should encompass 3 primary factors. One is flexibility, and this could include stretching or passive range of motion. Stretching or passive range of motion includes bringing the joint or the limb throughout the entire range of motion and holding it at the end range of motion for a specified amount of time. Strengthening and stabilisation. When we focus on this, you want to primarily focus on the trunk and the head control, particularly in SMA, where this could be more of a problem. And in regards to strengthening in general, you want moderate resistance and low reps. And of course, this is based on your individual baseline level of strength. And we'll talk about that with some of the videos in the chapter specifically about strengthening exercises. And then, of course, endurance. Endurance usually encompasses low resistance and higher reps, and it focuses on a more cardiovascular aspect of exercise. I always like to make sure that you give time to prepare your body. You can't jump into exercise cold. So here are a few techniques that may help get your body ready for exercise. First and foremost, you may want to do a gentle massage to increase the blood flow around the muscle groups that you will be working. And a massage may also be helpful after you exercise. And of course, we talked about stretching and passive range of motion. And then earlier, we talked about facilitation techniques to wake up the joint receptors by doing joint compression, neurological or neuromuscular education of the muscles itself by brushing or tapping. So this can be done before, during the exercises. So quickly, I want to talk about the benefits of stretching. In SMA, contractures may be a problem. We know that stretching does not necessarily prevent contractures, but it has a lot of benefits that indirectly affect range of motion and function. For example, increasing blood flow to the muscles by reducing arterial stiffness and passive stretch stiffness in the muscle, possibly, increasing lubrication of articular surfaces of the joints, decreasing muscle stiffness or tightness, in particular for individuals with SMA, with weak muscles. If you have tightness, your muscle's going to have to fight against the tightness in order to move. Therefore, some passive stretching may help your muscles activate and move throughout the range a little bit better. And then, of course, stretching is related to the amount of collagen, and collagen has known effects on exercise and aging itself to help improve that. Our usual recommendations for stretching varies. Most studies agree on stretching over a period of about 90 seconds. This is 30 seconds times 3 repetitions, with the rest period of 20 to 30 seconds in between sets to limit the stiffness. And this should be done per joint. There are a few different techniques that people use to help with stretching. During your stretches, there's one called contract relax, and is exactly what the title says. You're going to concentrate on contracting the opposite muscle you're trying to stretch. And this is best done in conjunction with your breathing. Okay, so you breathe in, you're going to contract your muscle, and then when you breathe out, your caregiver or you're going to passively move your limbs to the end position that you're looking for. And you repeat that until you hit about 90 seconds. During your strength and endurance exercises, you could have a caregiver do something called rhythmic initiation. There's 4 steps to this type of workout. You ask your caregiver to move you through the entire range of motion, because remember, your muscles may not remember what that feels like. So you're going to move through the range of motion passively, and as you're doing that, you're going to think about the muscles that should be working. And then your caregiver will provide active assistance for only areas of the range of motion in which you have difficulty moving. So the areas that you're able to move, you're going to actively move yourself. And the areas that you don't have the strength to do that movement, your caregiver will provide that gentle assistance. And you'll progress this with providing resistance to areas of the range of motion that are stronger. But the important part of this is to make sure that you do strengthening throughout the entire range of motion. Like I said earlier, different muscle lengths will have different strengths throughout the range of motion. So keep that in mind. And then you progress to where the exercise is a combination of working through your muscles' length tension curve with the caregiver providing assistance to functionally strengthen muscles throughout that entire range of motion. So here's a quick overview of what we just discussed. First and foremost, determine what your goals are, set those goals, and then look at strengthening exercises versus intensity of exercises. Decide what muscles are involved and should be working so you can use neuromuscular facilitation techniques. to help prepare your body during and before exercise. And of course, break down the task on how to do it. And throughout all of your exercises, make sure you do prepare your body. Don't forget the mind and muscle connection. The eyes are a great way to bridge that gap, looking at the muscles you're trying to work and thinking about activating those muscles. And of course, make sure that you have an assistant, a caregiver, or a helper to help you throughout the exercise or set up the exercise. Communicate with your caregiver what you're working on, what you may need, and the two of you can discuss what muscles should be working and when. And remember, quality of movement is much better than quantity. Do not use momentum. Momentum may get you there, but it's not quality in the activation of the muscles itself. And of course, track your workouts with an exercise calendar with the FITT guidelines that we discussed previously. And then, as needed and as able, use telehealth to talk to your physio to help start as well as guide the progression of your exercise.
Hi, this is Lola. Okay, she's going to help me today in teaching you some handling techniques to help the people you are working with be able to do some of the motor tasks that may be more difficult.
Chapter 1. Elbow flexion in a gravity-eliminated position. First, we'll briefly talk about progression, and this will be applicable to Chapter 1 as well as Chapter 2, reflecting elbow flexion progression. So as we just discussed before, you have different strengths at different points in your range of motion. And of course, you can add weights in any of these points in your range of motion to increase intensity, as the videos will show you. In this chapter, we'll talk about assisted gravity-eliminated exercises. You can have your caregiver also give assistance at any of the points of range of motion to help you move throughout the range of motion. You could see below, right here, is just an example of ways that you can progress elbow flexion intensity. The least difficult is here on the left, which is the gravity-eliminated elbow flexion, where your hand's on the table and you could use a cloth that's under your arm where you're able to assist your arm into full extension. Or you can have your caregiver help assist that. And remember, do it slowly and concentrate on the movement itself. And then you can go from assisted to pure gravity eliminated, where you're not using the towel for assistance and you're doing it on your own without gravity hitting the biceps itself. After you're able to do this, you can follow through with active elbow flexion. This is where your biceps have to move against gravity. And then as you get stronger, of course, you can increase weight. Remember that increasing weight could be done in the gravity eliminated position or the concentric active elbow flexion position. Also keep in mind that any of these exercises may be done in different muscle groups. This construct is translatable to other muscles as well.
So if you can start with the progression of having a towel here, and the towel can help assist to get your arm moving, right? And kind of pull in towards you, get that arm moving, okay? Let's try that again, okay? So, and I am activating this muscle right here, okay? So, wake up, come on muscle, move, 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 and then this arm or a helper can help you pull that arm in. As you get stronger, you can move this and you can do it without anything. So make sure you're working this part of the muscle right here, okay? And you can also turn it to where you're working that right here. Wake up muscle. Tap, 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 go. And then as you get stronger, you can add weight. It can even be as little as this. Okay. We could, if you have a hard time holding, can be this. Okay. You can progress up to a carrot. All right, so you get the idea, and then you can even progress up to something bigger, like a potato. Glide that, push that potato, go, 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 push the potato. Good, okay. And then, if you're even stronger, you can even try something as large as this. And if you have a hard time holding it, you can flat hand and push it, just like that, okay? And that is a strengthening, a progression of strengthening exercises that is gravity eliminated.
Chapter 2, Elbow Flexion Against Gravity, and Eccentric Control to Lower the Hand. In this chapter, we'll look at moving against gravity using household materials to increase the intensity. But at the end of the video, we'll also talk about using the triceps and activating the triceps to control your hand going down. Remember, in SMA, biceps or elbow flexors are stronger than the triceps, which are the ones that extends your elbows. And so you can work on these exercises, both elbow flexion and extension.
As you get stronger, moving from gravity eliminated in this position, you can move it against gravity. So now the biceps are working against gravity. So say, for example, bringing your hand to your mouth. Okay? So you can start with hands to your mouth. If you need some help, someone can assist you, kind of pull it up, pull it up, pull it up. And as you're tapping this muscle, up, 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 getting it towards the mouth. And then you may need help at different ranges. Okay? Right? And then as you get stronger, you can add different weights. And so different shapes will vary on your ability to hold it depending on how strong your hands are. So this one here, even if you have some finger contractures, you can try to lift and someone can help you do the part of the range that's harder. And then as you get up here, maybe you can do it by yourself, right? Okay? And it's nice because it's food, so it's a little more encouraging, maybe something more enticing than food. You could always start throughout the range of motion with different weights so that it accommodates how strong you are throughout that range of motion. So, you know, maybe you'll start with a cherry tomato, right, to just get lift off. Right up at this cherry tomato, and you have it, you're getting pretty strong. So right now somebody can give you something else. They can give you a piece of garlic. And then at this range of motion, you can lift this piece of garlic up to about here, and then maybe you can go a little bit stronger. Now you can switch the garlic to a lemon, right? So you can now lift up this lemon all the way up, all the way up, all the way up, and you try to control it so you don't smack yourself in the face with the lemon, okay? Once you get to the top, you don't want to waste your energy and not work the biceps in an eccentric fashion. So that's controlling the muscle. So now your biceps are going to control your arm going down. If your biceps aren't controlling it, you'll just drop your arm, right? So now that you're up here, you're going to try to control it all the way down, working that bicep as much as you can. Hold it. Come on, work it, work it, work it, work it. And don't let gravity take advantage of there. So what you may do is start it, and then somebody may have to take away the lemon and put a pepper or something in your hand, which is a little bit lighter, okay? And then now you can control the pepper, but you couldn't control the lemon, right? You control it all the way down, and then maybe here this is too much, and you'll just control it without anything all the way down. So these are different ways you can progress elbow flexion exercises with the things that you just have in your kitchen.
Chapter 3, Head Control. This chapter, I will briefly discuss how to progress neck muscle strength from supine to sitting. You will watch a video how caregivers may help to exercise isometric head control so you can hold your head up as well as actively engage your muscles to turn your head.
Okay, head control is another one that's really difficult because if you have a hard time holding your head up, you're going to need some kind of support, right? And so to help someone work on their head, you want to make sure that their shoulders are nice and stable. So a lot of times you can push pressure around the shoulder and support the shoulder really, really well. It's a good base for the head to rest on, okay? And then with that, you want to make sure your fingers are back here in the back of their head and the thumbs are up front so that you can basically catch their head if it falls forward or if it falls back, right? And so to start, you're going to really just have them balance their head based on gravity, and your fingers are there just to make sure that the head is nice and safe, because you don't want anyone to whip their head back or forward, okay? And so your hands are really, fingers are really close to the back of their head and their chin, okay? And then once they have that stable, you just increase the amount of time that they're able to do that. And as they get better, you may have them flex their head, then lift up. And these are the things you can do for someone with a really weak head. And remember, a lot of the times, if you want to work on your head, watch for your eyes, okay? So we'll have Lola turn her head, and we would have to say, hey, Lola, make sure can you look over there, look over there at the doggy. And then she'll try to turn her head, and then you're actively trying to help and assist with that, so you can teach the muscles to remember how to actually do that. So say, okay, look at the doggy, look, and then her eyes will follow the dog, and you'll help assist in that motion.
Here we talk about head control, starting in supine, moving into sitting, and also adding the trunk. This could be done first in the supine position, where you could do chin tucks. So you can see here, the arrows pointing down, and the patient has their hand on their chin to practice a chin tuck and activating those muscles. While you're here, this is a good time to also work on your breathing and trunk stabilization, where you see this arrow here as well, pushing down at where the belly button is. And here, as you're doing your chin tucks, when you tuck your chin, you can push the small of your back against the ground. And this works both your trunk stabilization as well as your neck. You can progress this into sitting chin tucks alongside trunk stabilization. And you can see the movement demonstrated by this video. Once you get nice stabilization, you work on small active head rotation. You can use some of the handling techniques from the videos with your caregiver to help you move through that range of motion safer. And as you gain more strength, you can add very, very slight resistance to hold your head in place. I don't recommend this until you consult with your physio to ensure that you do have the muscle strength to add this much more intense aspect of head control. Chapter 4, Sitting Trunk Control. This chapter will focus on caregiver handling techniques to help maintain upright sitting. Hello. My name is Tina Duong. I'm a physical therapist at Sandford University, and I'm going to talk to you today about exercise and muscle training techniques for SMA families and patients during the COVID-19 lockdown. So these are the things that you can do when you're at home and unable to see your therapist or your care providers.
So in sitting, what you want to do is be able to control the pelvis, right? And so your hand is going to have to be right at the pelvis, in which you're going to push down, okay? So you're going to ground the person, you're going to push down, and your thumb is back here where you can have a little bit of control. For adults, you may have to have two hands like this because, your hands may not be large enough for adults, but you want to make sure you have this downward pressure, and then you're kind of controlling things for them to sit by giving this downward pressure through your hands, okay? And you can help them lean forward, even assist them leaning back as much as possible with your hands, okay?
Chapter 5, Trunk Control. This chapter will talk through how to activate your abdominals and your back muscles together for better upright sitting, as well as provide an example of a progression of trunk control as you get stronger, and methods for stretching for your mid-back to allow for better thoracic extension or upright posture.
Hi, to get started today, before we do any stretches or exercises while seated in a chair, I want to talk to you about breathing and using your trunk muscles in order to activate that while you're doing your exercises. So it's very important to have a stable base for you to move your arms and legs whenever you're doing any kind of exercise, but particularly if you're seated. So the first thing is we want to activate our back muscles and our abs together to create pressure around this trunk. And in order to do that, you may want to try to put your hand in the small of your back, right here, and then your hands at the top of your stomach. And what you're going to feel is squeezing it together. It's like you're going to squeeze this belly button and push it into the small of your back. Okay, do you feel that? It makes you sit up a little bit taller. And so what we're going to work on is when you breathe in, you see me lift just a little bit. What's going to happen is it's going to feel like there's a string at the top of your head. You're going to breathe in, and then when you breathe out, you're going to push that belly towards the back of your spine. Okay, we're going to work on that. Breathe in, strings pulling you up at the top of your head. Good, and breathe out, push that belly button from the back of your spine, but don't round your back, sit up nice and tall. Good, one more time, and up. Strings pulling you up, feet are nice and grounded. And then you're going to push out, your belly's pushing towards the back of your spine, staying upright, shoulders pressed. And one more time, here we go, up, spine up. Good, breathe out, belly button towards the back of the spine. Blow all the air out like you're blowing out a candle. Great. So that's what you're going to do when you work on all the stretching exercises and the strengthening exercises. So that's being worked in combination.
So let's talk about the sitting position. Typically, any of us, whether we have SMA or not, we typically look like this. This individual has a very flexed neck, and you can see this is what we call a kyphotic spine, where the spine is flexed, and we see that a lot with any of us who's sitting looking at computers, but particularly for individuals with SMA. And then you have this posterior tilt where your lower back is also rounded. And then the shoulders are also rounded and tipped forward. All of this combined makes it more difficult to breathe, causes pain, and difficulty moving. So we want upright sitting. And upright sitting you can see demonstrated here by this picture. The thoracic extensor muscles are working. Sitting upright, you can use the techniques from the previous chapter of chin tucks and trunk stabilization to get a more upright mid-spine. So you're not in that kyphotic curved position at the middle of your spine. And then you should have a slight lumbar lordosis or a slight curvature in the small of your back. You want to activate your abdominals just like you did in the trunk stabilization exercises. And then what you're going to do here is get that nice upright sitting. And you can increase the intensity by increasing the amount of time that you're able to do this. Once you achieve this, you may increase the intensity by adding arms. You can try lifting your arms. It does not have to be high. Just the activation of your arms requires and demands more from your trunk muscles. And then once you're better with that, you want to try active reaching. So you'll reach forward, you reach to the side, and you'll rotate. And as you're doing that, you're going to maintain your trunk control throughout this entire process. With trunk control, I like to talk about thoracic extension. This is particularly important for individuals with SMA because of that kyphotic or that curved spine I mentioned in the last slide. Here's a few techniques that you could use to open up your thoracic spine. You could see on the left here that you could put a towel roll or a foam roller in the middle of your back and basically lay on top of it. This helps in many ways. Not only does this help stretch your thoracic spine, it opens up that area of your chest that is curved in from constant sitting. So let your arms fall to the side and let gravity slowly stretch this aspect of your shoulder. If you're stronger, you can actively stretch your thoracic spine by going on your forearms. And to increase that stretch just a little bit, you can also add a piece of material where your hands are pulling down on the material as you're stretching that thoracic spine and getting a more intense stretch. Chapter 6, we'll talk about transitions, including lying all the way to standing. This chapter will provide examples of key areas to focus on as you work on transition activities and handling techniques required to go from lying down to rolling to your side, to kneeling, and to standing. We will also discuss open and closed chain type of activities that relate to how your muscles work to improve function and progression. In SMA, progression of pelvic girdle strength is highly important. If you're not yet able to stand, try working on tall kneeling, such as this example here. Tall kneeling is important because you're working on your glute muscles you want to try to maintain this, and you're going to increase intensity by the amount of time that you're able to spend in tall kneeling. For facilitation techniques, what is useful is to have the caregiver's hand placed on the top of your hips, and they can help wake up those muscles by compressing or pushing down through the knees. So they push down so your muscles are co-contracting together to hold you upright. Like I said, increase the time as you get stronger, but then also as you get stronger, shift your weight from your right leg, hold it there, then to your left leg. Weight shifting is very important for any activities that require your lower extremities to be planted on the floor, such as with walking.
Supine, okay, to getting up. So sometimes they need help with rolling, and so you want to help roll them to the side, okay? And then what do you do once you get to sideline? You want to be able to sit up, right? And so you're going to facilitate that by what do your muscles do? Okay, so this arm down at the bottom, you want to make sure that it's in a position where the person can push down. And you're going to facilitate that downward pressure by kind of pushing down through the shoulders, okay? So they can push down through their hands, and then you're going to facilitate the side flexion by having your hand at the hips right here. You're going to push down, and then that's going to be done together, okay? So you have a nice synchronous movement so that they can motor learn how to sit up, and you're going to do this repetitively over and over and over throughout that entire range until they get better at that skill or stronger, okay? Once they get to sitting, you want to be able to get into tall kneeling. And so in tall kneeling, you may want to have a bench or something so they can hold on to, but again, they may get into all fours, okay? So getting into all fours, there's a lot of things that are complicated here where you have to activate everything because it's kind of like a plank, right? So you want to make sure the shoulders are activated. So you're going to push down through the shoulders. So it's kind of a down and back. So you're going to push down and also kind of push them into thoracic extension, okay? So you're pushing down through the shoulders because the arms need to remember what they need to do. In order for a position to be functional or functional strengthening, you're going to push down through your limbs, right? So you're going to have them push down through the arms. And then now what? So now that they're in this position, this push-up position, you need to get the hips activated. So you want the hips to where it is directly under the knees. So what you may do is scooch them back, okay? So when you scooch them back, get the weight underneath them, just like this, it gives them a better position to be able to now, you're going to facilitate pushing down through the hips, okay? So the pushing down through the hips wakes up the hip, the pelvis, the trunk, and the legs so it co-contracts and stabilizes. So you do that throughout for the entire body, okay? And they're right through here, okay? And so then you facilitate a upward kneeling, okay? Maybe a table or something right here, okay? So then for kneeling, what you want to do is a similar concept. They may need help with bringing the leg out, and so depending on what leg they're moving out, they're going to have to shift their weight. So what you do is you help just shift their weight over, okay? Once you shift their weight over, now you see this leg is already up. This will make it easier to pull this leg up right here, okay? So once you have the leg up, again, similar concept, you want to push down. You're going to push down through that leg to get the quads activated, right? And so that's exactly what you're going to do. You're going to push down right above the knees, okay? And if it's a smaller child, you can have your thumb kind of facilitate hip extension going up, okay? And if there's a bench in front, you do the same thing. You know, you may have to have 4 arms to do this, but you can always get a helper, right? So then same thing, downward pressure, and that facilitates up to standing.
And then, of course, knee extension. Knee extension is a muscle that is quite weak in SMA. There's 2 types of knee extension exercises. You can see here in this left picture, it's open chain. Open chain means that your feet are not on the ground. I see a lot of people doing these exercises where they try to extend their legs all the way straight and bring them back down, which is perfectly fine and great. You can progress that with adding weights, but please don't add weights until you're able to move through that entire range of motion. Next are closed chain activities. These tend to be my preferred activities because it translates better to function. If you think about it, any activities that you have to do that requires walking, your feet are planted on the ground. So you can progress this by having the chair at a higher level and try to go into a standing position. And as you get stronger, lower the surface area that you're sitting, and it makes it more difficult to stand up. Here's just an example of progression of pelvic girdle strengthening, as well as with upper extremity support and time. So in standing, if you have the strength for standing, like I said, stand with 2 legs, followed by transitioning to standing with 1. And of course, if you're not yet standing, you can do this in tall kneeling. You then add one-legged stance with hands and then without hands. And then you can progress by moving your hands up over your head. And then this is a much more higher intensity exercise. And I do suggest that if you do get to this point, there should be a caregiver and a consultation with your physio. Like I said before, this is an example in standing, but could easily be translated and definitely recommended that you do this in tall kneeling as well to progress into standing. Breaking down the task. So for example, sitting up from supine, so sitting up from lying down, you want to break down the task. An example of that is rolling to your side or rolling into your stomach and then pushing up with your arms, using your elbow extensors, pushing into the ground. If you're working on getting on all fours or trunk strength, this is where you can work on your trunk, your pelvis, your upper limb, and your shoulder stabilization. Remember, this is going to require co-contraction, so it's a good use of joint compression in the neuromuscular facilitation, and those techniques are represented in the videos that you've just seen. And of course, we talk about tall kneel and half kneel. This is very important not only to stretch the hip flexors that tend to be tight, especially for those of you who are in a wheelchair all the time. So make sure you do this tall kneel position. It's good for pelvic strengthening. You can also work on a modified plank and then upper limb, adding the upper limb to this. Of course, sitting up from half kneel or tall kneel, you have to work on your trunk stabilization and then your upper limb strength, because to get up from tall kneel, many of you will need to push on an object. So make sure that your hands are pushing down and you're getting the co-contraction at your joint and gradually pushing into elbow extension. And with your lower limbs, you'll need to activate those hip extensors and knee extensors to get into full upright. Of course, there's different ways to getting started. The most important thing here is to make it fun. You can find friends maybe to do it with, or caregivers or your parents to do it at home, or you can do it on video and also make it a habit. We talked about it earlier that it should be consistent. You should be consistent in the frequency and what you're doing, encompassing strengthening, flexibility, and cardio. Start slow because being consistent is better than doing really intense exercise only one time a week. And of course, set your realistic goals to be short-term initially and use technology to your advantage. Make your virtual exercise community by tracking your workouts, using online courses, and connecting with friends, as well as doing telehealth to provide feedback for good body mechanics for your exercise routine.